Water flossers have been around since 1962, and there are countless published studies proving their effectiveness at removing plaque from the teeth, the gum line, and the pockets of space below the gums. They're available in different styles and designs, and I have a selection of popular models here. Now you can have the larger countertop models like this one, the compact or cordless varieties like this one, and there are also hybrid models like this AirFloss, and this blasts out a combination of air and water. Now, all of these models are really great, but they're relatively expensive. Prices vary, but you'd normally expect to pay between $70 and $80 for these types of products. However, today we're looking at a cheaper option. This FairyWell cordless water flosser is retailing for around $37 at the moment, which is about half the price of its competitors. Now, the manufacturer sent a couple of flossers for our team to test out, and if you click the link above or in the description below, you can read Dr. Lara's full review. But we actually bought this one ourselves just to unbox it for you. So let's check it out. So this is the FairyWell 5020E oral irrigator here, and if I open up the box, we can have a quick look at what's inside. So you can see we've got the flossing unit itself here, a box of cleaning tips, the charging cable and the instruction booklet, and we've also got the warranty card. Now this flosser comes with a 12-month warranty, and FairyWell will also give a full 45-day money-back guarantee, which is a pretty good deal. You also get 8 cleaning tips in total if I open up the packet here, and they're easy to use. I can just pop one on and it locks in place. Now it's recommended that you replace these tips every 3 months, so this box full will last one person 2 years. Or if you share the flosser with your partner, then they'd last a year. The tips are really easy to change. You just press the button and then pull. Sharing the use of a water flosser is fine, but for hygiene reasons you should never share the cleaning tips. Now if you have a look closely, you can see that these do have a ring at the bottom. You can actually get these refill tips with white, blue and grey rings on them, so that you can choose a colour and then keep your tips separately. The flosser itself feels well constructed and well finished throughout. It's much cheaper than the Waterpik and the Sonicare models, and it certainly doesn't feel cheap. This unit's also rated as IPX7 water resistant, which means it can withstand immersion in water up to 3 feet deep. And that means you can safely use it in the shower and even wash it in water without damage. Now it comes with a USB charging cable. You just pull out this cap here on the device and then plug it in here. And you can charge the flosser from a computer, from a power bank, or even a USB socket adapter. Now a full charge will last about 21 days, and it takes around 4 hours to charge the battery. The water reservoir here holds 350 millilitres of water, and this will give you around 1 minute of flossing time. But filling the flosser is really easy. You just flip the cap and then you fill it with normal tap water, or alternatively, if you suffer from sensitive teeth, you may want to fill with lukewarm water to avoid any hypersensitivity. This flosser is so easy to use. There are just 2 buttons, the on button here and the mode selector button here. There are actually 3 cleaning settings to choose from, so you've got clean, soft and massage, and you just need to keep pressing the mode button to make your selection. The clean setting is the most powerful of the 3 modes, and this expels a jet of water at around 90 pounds per square inch at 1,800 pulses per minute. The soft mode, on the other hand, gives a more gentle clean with a water stream of 40 pounds per square inch at 1,400 pulses per minute. And the massage mode fluctuates the pressure and pulses to basically manipulate the gum tissue and to stimulate blood flow to help promote healthy gums. Now, many cordless water flossers have a maximum pressure setting of 75 pounds per square inch at 1,400 pulses per minute, but this FairyWell model outpowers most competitor models with a maximum pressure of 90 psi at 1,800 pulses per minute. Now here, I'm actually going to spread a mixture of sticky peanut butter and and chocolate sprinkles right into the kernels of this corn on the cob. Now, as yummy as this mixture might be, you definitely don't want this sticking in between your teeth, because this is the stuff that cavities are made of. Harmful bacteria will really gobble this stuff up and produce the acidic byproducts that cause tooth decay and gum infections. If you've never used a water flosser before, you should always start with it on the lowest setting until you become used to the power. So I'll start this flosser in gentle mode first, and even at 40 psi you can see it does a pretty good job at removing the peanut butter. Now if I switch to the clean mode here, you'll see just how much power it has at 90 psi and how effective it is at removing debris. Finally, if I switch to massage mode, you can just see how it manipulates the water flow to create a more therapeutic movement. Although oral irrigators like this one have been around for a long time, they're still slightly controversial. Not every dentist approves of them, and they aren't used that widely. However, given the wealth of published research that proves how valuable and effective they can be, it is surprising that dental professionals don't recommend them more often. Statistics tell us that gum disease is reaching epidemic proportions throughout the country, and it may be time to recognise the fact that traditional oral hygiene advice just isn't working for much of the population. Research suggests that many people are either not flossing regularly or flossing with a poor and ineffective technique. Liquid irrigation is commonly used in medicine for the treatment of open wounds. Clinicians use a stream or a pulsed stream of liquid to remove dirt, cellular debris, and pathogens from a wound to prevent infection and aid the healing process. Oral irrigators have exactly the same therapeutic benefits when they're used in the mouth. They remove food particles and bacterial plaque. They flush out and cleanse the gum pockets associated with gum disease. And they leave your mouth feeling lovely and fresh. The main complaint that some dentists have is that water flossers just don't remove dental plaque as well as string floss. And although this may actually be true, research has shown that even if the water flosser doesn't remove all the plaque, the pulsating water jet can irreparably damage the bacteria in plaque and prevent the production of that toxic waste that causes tooth decay and gum disease. So, if you suffer from gum disease, a water flosser is a great tool for cleansing the mouth and halting the spread of infection. If you already have good oral health, this device can help prevent oral disease in the future. And for people who have braces or dental implants, this is one of the best ways to clean the areas that a toothbrush simply can't reach. You can also increase the therapeutic effects of a water flosser by adding active ingredients like chlorhexidine, fluoride, peroxide, or essential oils. And the easy way to do this is to add some medicated mouthwash to the water mix. If you're interested in adding oral irrigation to your daily health routine, then we would highly recommend that you check out this FairyWheel model. It retails for about half the price of a water pick or an air flosser, but in terms of build quality, performance, and effectiveness, it's every bit as good, if not better. For more information, click the link in the description.